All right, so we're about to look at another set of very important medical professionals, right? So this is what is now as well the community health workers. You understand? So they usually abbreviate this as what? CHW. Now, in some places you see it being abbreviated as well, CHEW. You understand? So it depends. Okay, that CHEW is what? Community health extension workers. All right, it's still the same thing. It's still the same thing. So these ones, before we go into the lecture, start talking about their functions and all of that, their roles, just so you know that a doctor can actually handle everything. Do you understand? So you have to actually bring other arms of what? Medical professionals in, so that at least they can handle some one or two jobs to make things like easier for the doctor and all. You understand? So community health extension workers, they are just a frontline what? Public health professionals. So they play very vital roles, okay, in connecting communities with health. All right. So these ones, they are not just sitting in the hospital. They are actually going to the people in the community to be able to render some one or two services to them. Okay. So a comprehensive look at them. They are typically trusted members of the communities they serve. They often share similar culture. So most community extension workers, maybe they are from that same state in the country, or they are from a similar region in the country. They can easily blend with the people and know these people, like, by cultures and all of that. So they may not have any formal medical training, but they are equipped with some practical knowledge, at least basic things like taking a BP. Do you understand? Taking medical history. You understand? Taking blood pressures. Okay, yeah, blood pressure is a BP. Then body temperatures and all of that. They can actually do it. All right. So they are equipped with practical knowledge and skills to support health initiatives at the grassroots. All right. So these are different ways in which they call them. All right. Promoters, the salute, community health advisors, health outreach workers, village health workers. All right. You could see them dressed like, all right. So what do they do? Of course, they are like the bridges between what? The healthcare system and the communities. All right. Because as for them, they don't just stay in the hospital. They actually take some services right to the patients. All right. They actually take this, right? So they do things like what? Health education and promotion, outreach and advocacies, basic health services. All right, like first aid, monitoring chronic condition. A doctor can send them to a patient. You understand? Yeah. Navigation support, data collection. So they often make home visits, hold community meetings, provide informal counseling to build trust, and also improve health literacy. Okay, do you understand? They can actually be advising a patient on one or two. All right, and to help the patient. All right. So they are very important because they improve access to what? Health. Community access to health. They reduce health disparities. All right. They support public health goals and they build trust. Okay. They build trust.